Conflicts of interest policies most frequently cover the following types of conflicts. A. Duty. B. Personal. C. Financial. D. Familial. The largest obstacle to remote learning is typically A. Having an unreliable internet connection. B. Dealing with distracting environments. C. Maintaining the motivation to learn. D. Using technology correctly. Which website offers a hospital grade that demonstrates compliance with requirements in several areas, including certain surgical operations like a total hip replacement and a pancreatic resection for cancer? A. Leapfrog Hospital Safety Grade Rankings. B. National Committee for Quality Assurance Report Cards. C. Health Grades. D. Centers for Medicare and Medicaid Services Care Compare. In succession planning, the first step is to A. Develop a formal written succession plan. B. Develop plans for emergency and planned succession. C. Outline the needs of the organization. D. Describe the behaviors and leadership qualities needed for the role. When a project schedule performance index is 93% and its cost performance index is 105%, it is said to be A. Behind schedule and under budget. B. Ahead of schedule and over budget. C. Ahead of schedule and under budget. D. Behind schedule and over budget. The first thing to take into account when conducting a review of the literature as part of the investigation of best practices is the A. Evidence. B. Source of the material. C. Author's credentials. D. Thesis. Performance can be monitored most successfully by A. Data collection. B. Observation. C. Personal interviews. D. Self-assessments. The American Nurses Association lists 3 essential components of a healthy work environment: empowerment, fulfillment, and A. Service. B. Compensation. C. Safety. D. Flexibility. The appropriate task, situation, person, and direction are among the 5 rights of delegation. A. Time frame. B. Supervision. C. Authority. D. Responsibility. The NPD scope and standards of practice state that one of the responsibilities of the NPD practitioner for Standard 1, assessment of practice gaps, is to A. Maintain current knowledge. B. Analyze trends and supporting data. C. Maintain current knowledge. D. Identify the desired outcomes. Sensitive information must first be protected by A. Develop a plan to safeguard sensitive information. B. Determine where information is to be stored. C. Assess the types of information safeguards that are currently in place. D. Identify which information needs to be protected. When in the conventional project life cycle, does the project manager give stakeholders a precise estimate of costs and performance reports? A. Implementation. B. Closeout. C. Concept. D. Development. Which of the following is essential to online education? A. Vocabulary list. B. Interactivity. C. Scheduled break times. D. Detailed outline. The best course of action when an NPD practitioner is requested to oversee a project outside of their area of expertise is to A. Hire additional staff. B. Use consultants. C. Refuse to manage the project. D. Carry out intensive study in preparation. Which of the following best describes a valid assessment of a learning need? A. The nurses on this unit state never having worked with unlicensed assistive personnel before and need a class on appropriate delegation skills. B. Our quality review identifies 10 medication errors this month, indicating a need for a class on medication administration. C. We must teach the staff to use the patient care assignment sheets at the beginning of each shift. Conflicts of interest policies most frequently cover the following types of conflicts. A. Duty. B. Personal. C. Financial. D. Familial. The NPD professional intends to hold a focus group and is aware that focus groups typically consist of A. 13 to 20 individual. B. 3 to 4 individual. C. 5 to 7 individual. D. 8 to 12 individual. The following transition criteria are mentioned in Afaf-Melius's Transitions Theory of Change. A. Process indicators and outcome indicators. B. Critical points or marker events. C. Awareness and engagement. D. Facilitators and inhibitors. If a new kind of electronic device is offered to healthcare networks, the following should be taken into account before buying it. A. Ease of use. B. The life expectancy of the device. C. Device integration. D. Cost effectiveness. When coaching, the main priority should be A. Using questioning to help learners recognize problem areas. B. Pointing out areas of weakness or errors. C. Watching the learner carry out demonstrations. D. Developing goals for the learner. Which circumstance is most conducive to the employment of scripting as a communication tool? A. Providing a patient with discharge instructions. B. Providing a painful treatment. C. Comforting a parent whose child is ill. D. Participating in a team meeting. How much time should be allocated to completing the grant application if the nursing professional development practitioner is submitting it to the Health Resources and Services Administration or another government agency? A. 100 hours. B. 40 hours. C. 20 hours. D. 10 hours. When using critical chain scheduling to make sure that a project with constrained resources is finished on schedule, it is essential to A. Project buffer. B. Resource buffer. C. Feedback buffer. D. Task buffer. The largest obstacle to remote learning is typically A. Having an unreliable internet connection. B. Dealing with distracting environments. C. Maintaining the motivation to learn. D. Using technology correctly. The lecture format is most suitable when A. Educational material is complex and detailed. B. Learning involves attitudes and feelings. C. Objective is to achieve long-term retention of knowledge. D. Primary purpose of education is the delivery of information. Asking participants to do the following is an example of a learning target based on the cognitive domain. A. Demonstrate drawing blood from a central line catheter. B. Explain how they feel about caring for patients with terminal illness. C. Identify 2 risk factors for heart disease. D. Remove a colostomy pouch correctly. When creating an educational program, what comes first? A. Apply for an educational grant. B. Assess the internal and external environment. C. Determine how available resources will be used. D. Promote new services and programs to targeted employees. Which factor is most useful when choosing a teaching strategy? A. The method facilitates meeting the learning objectives. B. The physical characteristics of the classroom accommodate the method. C. The teacher is skillful in, and comfortable with, using the method. Which presentation approach increases content retention among 250 nurses? A. Administering a test after the presentation. B. Providing a printed reference list to participants. C. Requiring a reading assignment prior to the presentation. D. Using an audience response system or video clips. The nursing professional development practitioner audits patient chart 6 months after a documentation education activity. What kind of appraisal is shown in the audit? A. Content. B. Impact. C. Outcome. D. Process. What justifies the formative assessment of a learning activity? A. Address learners' progress throughout the activity. B. Check for adequacy of the program objectives. C. Examine the achieved outcomes and impact. D. Set the direction for the future. As a leader, the nurse professional development practitioner's key responsibilities include A. An operational position, rather than a staff position. B. Alignment of educational operations with organizational goals and needs. C. Involvement with organization-wide committees. D. Participation in both policy and procedure development and monitoring activities. A Department of Education's mission statement should aim to A. Acknowledge consumer needs and wishes. B. Define the nursing professional development practitioner's roles and responsibilities. C. Guide the department's objectives and purpose. D. Reflect employees' values and scope of practice. Which of the following is true for nursing professional development certification? A. Certification guarantees that standards of care will be met. B. Certification is a means of licensure and public protection. C. Certification measures the nurse's knowledge of the specialty. D. Certification measures the nurse's level of education. Which position presents the most challenge for preceptors? A. Educator. B. Evaluator. C. Role model. D. Socializer. According to the nursing professional development practice paradigm, one duty is to A. Patient safety. B. Staff orientation. C. The learning environment. D. The quality of care. Which talent needs to be mastered the most by a new nurse professional developer? A. Communicating effectively. B. Coordinating programs. C. Managing resources. D. Serving as facilitator. The American Nurses Credentialing Center grants the following credit for continuing education programs. A. Certificates of attendance. B. Contact hours. C. Continuing education recognition. D. Continuing education units. A staff and service on email patient communication is planned by the nurse who oversees professional development in nursing. What factors should you prioritize? A. The educator's access to the internet. B. The patient's access to computers. C. The patient's literacy levels. D. The statutory or regulatory requirements. The nurse who works in professional development fosters a learning environment by A. Creating new models of providing patient care within the healthcare system. B. Deriving outcome data from process improvement implementation. C. Identifying total staff numbers taught at organizational educational programs. Which technological approach can evaluate, diagnose, and integrate therapies for a patient experiencing cardiopulmonary arrest the most faithfully? A. High-fidelity simulation. B. Interactive computer program. C. Podcast. D. Video case presentation. The learner engagement goal is the focus of the nursing professional development practitioner's learning activity design. Which teaching method is most likely to achieve this? A. A podcast. B. An audience response system. C. An electronic slide presentation. D. An electronic text. The first step in establishing a quality improvement program for the education department is to A. Clearly define the program's purpose and functions, and the processes by which the services will be provided. B. Design an evaluation program that includes quality control, technology measurement, and performance measurement. C. Develop an evaluation tool to assess the quality of services provided by the department and the desired outcomes. A nursing professional development practitioner contacts a renowned speaker to deliver a keynote talk at a National Nurses Week seminar. The practitioner seeks to A. Develop a staffing plan with the nurse manager to promote attendance. B. Generate collaborative agreements with other agencies. C. Obtain a written agreement from the speaker confirming the honorarium and reimbursement of expenses.